Welcome to Muskegon Rising, a community service project of the Muskegon Rotary Club. Our purpose is to create lasting positive change. We've been doing that here since 1916. So, let's get started.
Hello, my name is Nancy Crandall. I'm a local Rotarian and here today to talk with our guest. Do you think you'll ever need hospice care? How is that arranged? And what is palliative care? We're going to address these questions by talking with Susan Hausman, Executive Director of Harbor Hospice, Muskegon. Susan, welcome.
Hi, Nancy. Thank you for having me here today.
Tell us about hospice care. What exactly is hospice care?
Sure. I appreciate you broaching this subject because it's often a topic that many people avoid talking about. Hospice is a medical specialty that is provided to patients and their families that provides care and support for people who are facing serious illness or nearing the end of life. It is actually a fairly new specialty, about 40 years old. We had its founding in about 1980. In our community, we had some local pioneers, Sue Wieringo, Marianne Gorman, who had a vision for providing end-of-life care differently. I think of my own father, who passed away here in Muskegon in the mid-'70s. I was just a first-year nursing student. He was diagnosed with metastatic cancer, and this was before hospice came to be. And I remember watching him suffer. He had pain, and I, as an early nursing student, really didn't understand how to help him. I did my best, try to straighten the bed and fuss around and try to make him comfortable. But I think things could have been different for him and for me if we had had the gift of hospice to help us with his suffering and for me left behind with my grief.
Interesting. I had similar experience with father and a brother.
Mm-hmm.
Tell us about Harbor Hospice.
Sure. We've been in the community for over 40 years now. We're located downtown at our main offices at the Fricano building, downtown Muskegon. We also have a hospice residence out on East Mount Garfield Road at the Leila and Cyrus Poppen Hospice residence. And we serve a 5-county area all the way from Ludington to Holland, actually along the lakeshore, and east towards Grand Rapids, about halfway there. So a 5-county area, Mason, Oceana, Ottawa, Newaygo, and Muskegon counties.
Wow, that's a big service area.
So we started out in 1982, served our first patient in 1983. We have grown now on an annual basis. We serve between hospice and palliative care over 1,500 patients a year. So it's quite a responsibility, but an honor to serve our community.
And I think people are familiar with the Poppen Home and some of the care that you give, but describe the in-home care. I think that's what a lot of folks don't realize, how you do that.
Yeah. Hospice, that's the beauty of hospice. Most people in our community envision themselves at home at the end of their days, surrounded by their loved ones, and we definitely support them to do that. We have a full care team of physicians, nurses, social workers, chaplains, volunteers that come into the home to help support the family, the caregiver, or whoever the patient identifies as that primary caregiver, and comes alongside with them to provide the care and services and make sure that their experience matches what their goals and wishes are at the end of life.
Well, you talked about the big service area. How many employees do you have, and how are these folks trained to do what they do?
Sure. We have 125 employees right now at Harbor Hospice. both in the, providing in-home services, palliative care services, grief support, and at the Poppen residence. Most of the clinicians that come into our organization already have some type of licensure, certification, professional credentials, our physicians, nurses, social workers. But we also provide intensive training when they come on, both virtual training through some learning platforms that specialize in hospice and palliative care. And of course, they get one-on-one training with an experienced provider. This usually takes weeks or months for clinicians to get the expertise they need to provide hospice services.
And tell us a little more about the Poppen House.
Sure. The Poppen House was, the Island Cyrus Poppen Hospice Residence was built in 2005, and it was, again, a vision for the community of providing an option to care when that home care is not available. It's a 14-bed residence nestled there off of East Mount Garfield Road in a wooded area, very serene, quiet, and peaceful setting. And reasons that people might need Poppen residence versus being cared for in the home are many, but a couple of them would be intensity of symptoms that patients are experiencing related to pain or shortness of breath, anxiety, restlessness, these types of things may be more than the family can handle at home at the time. Oftentimes, caregivers have their own health needs, or maybe they're getting up there in the years and they don't have the physical capacity or get emotionally drained. And so the health and well-being of the caregiver is important as well. So the Poppen, beauty of coming to the Poppen is that we can then provide that care and allow families to spend that precious time being together rather than having to provide the daily care and be worried about tasks at hand, if you will. So we also provide respite services at the Poppen residence. So if a patient is in care in the home, we can give a break to the caregiver for up to 5 days on a regular basis. So for instance, if a caregiver was having surgery or they needed to attend a wedding or some other social engagement, they could have their loved one come to Poppen and we would provide that care and then they could return home.
What a wonderful service that is. I don't think people realize that. And you mentioned the term palliative care. Yeah. Tell us what that is, please.
Yes, thanks for bringing that up as well. Palliative care and hospice care those terms are often used interchangeably, and they are not the same thing. Palliative care is really provides two things. One, also providing symptom management to patients in the community, but also coming alongside the patient and family to help understand the disease trajectory, if you will, get themselves ready for what's coming next, and to help make decisions as their disease progresses. The difference between hospice and palliative care is that in hospice, in order to be enrolled, you have to meet a life expectancy of 6 months or less, and that is certified by either two physicians, your attending physicians and the hospice physician. If a patient can have a serious illness and not be in that 6-month window, if you will. So palliative care can come in earlier if hospice is not an option for that patient and they're having trouble managing their symptoms. They also may elect to pursue curative treatments and want to continue to do that and are not in alignment with a hospice philosophy, but they still need assistance in providing symptom management. That's where palliative care can come in and help them with those symptoms. So, for instance, a patient who is getting chemotherapy may be having issues with pain or unretractable nausea. Our palliative team can help with that so they can have a better quality of life.
Oh, wonderful. How is all this paid for?
Good question.
It's always the money.
Well, the beauty of hospice and the hospice movement is in the late 80s, Medicare and Medicaid recognized hospice as an important benefit for their beneficiaries. So the majority of our patients are covered through either Medicare or Medicaid. We do accept all other insurances as well. And we, as a nonprofit, community-based organization, our mission is making sure that no one has a financial barrier to access hospice services. So we have grant funding, we have support through our Harbor Hospice Foundation that helps patients, so payment is not a barrier.
Wonderful. Wow. What about you, your background? How did you get into hospice work?
Okay, well, I will tell you that I don't think I'm a nurse, and I didn't wake up one day thinking I was going to be a hospice nurse or an executive. I have been a nurse for a long time, and I grew up here in Muskegon. My dad was a pastor, and we were called here when I was 3 years old, and I moved out of the area when I was in high school, and my dream had been to come back to West Michigan. Finally able to do that after my husband and I raised our children, and we decided to relocate back to West Michigan, and our plan was to commute to our work in Grand Rapids at the time. And I ran into a colleague of mine who told me about the opportunity at Harbor Hospice, and I jumped at the chance. I initially came on board as the director of clinical services and moved into this role, and just at the start of COVID in 2020, and a challenging time. But I feel that sometimes you might say that the stars align, that I'm in this position, but I feel that it's a part of God's plan, and that all my experience as a nurse, both at the bedside and in leadership, have prepared me for the role that I am in today, and I couldn't feel more at home.
That's terrific. So where did you go to nursing school, and where were you working before you moved back to Muskegon?
Yes, I attended Eastern Michigan University, got my bachelor's of science in nursing there, and had been working in Grand Rapids in a post-acute care and assisted living, independent living setting. I had worked for Lutheran Social Services of Michigan for many years, and was exposed to hospice then, and helped many patients elect hospice in senior living. So I had a passion for that already, but now it's my life's work.
Well, it sounds like you're very well prepared for it. You mentioned the Hospice Foundation that helps fund some of the work you do. I know you have some special events throughout the year that help raise money for the foundation. Tell us about those.
Yes, we have some really fun events and some legacy events, but one is a purse party that we have every year up at the White Lake Eagles, and we have get donations of purses that just come in by the bucket loads, and all those proceeds help us to support our summer camp for kids who are grieving. It's called Camp Courage, age 6 to 14. And this year we raised about $10,000, I believe, for camp. And
with purses.
We had over 40, about just close to 40. We had 40 kids sign up, and just shy of that we were able to serve at camp this year. We also have a regatta every year where we raise money. We have sailboat races, and those funds help us support our Case for Support, whatever that might be for the upcoming year. Next year, our Case for Support will be raising money for our Poppen Hospice residents. It The care and services are reimbursed through Medicare, but the physical plan itself, the building, the grounds, all that it takes to operate a 14-bed residence is not covered by Medicare. So we're going to be celebrating our 20-year anniversary at the Poppen residence this year. But with that, some things need replacement, and so we're trying to plan ahead to raise funds for that important
And it's nice
building.
that the regatta has the tie-in with the Poppen family.
It does,
Sherm
absolutely.
was a famous sailor at the Yacht Club for years.
Yes.
Yeah, that's fun. And you mentioned the Camp Courage. Where is that held?
That's held at Pioneer Trails Camp, just north Muskegon.
Yes.
And we've been holding that for over 30 years now.
Wow, that's great. What a wonderful service you provide. Anything else you would like to add or tell our audience that we haven't covered?
I would just say don't wait too long to have conversations with your loved ones about their wishes at the end of life. I'd like to say we should plan and spend time, just as much time as we would when we are expecting a new life into our family. We have 9 months, and you go to your physician and you talk about things and you prepare, and I don't think it should be any different.
That's
when
a great
someone
reminder.
is at the end of life.
Yes.
Talk to your family. Tell them how you envision that to be, things that you want to accomplish. It's difficult to face our own mortality sometimes, and we have things we need to work through. But the sooner that we can talk about that, the better. And we do assist patients and families with putting those things in place and walking through those conversations. So our social worker on our palliative care team provides that free of charge to the community and helps get those documents in order, called advanced directives. And we're happy to help with those conversations. So
that's terrific. I love the reminder of preparing for life for 9 months, and you should be doing that on the other end of life. Well, this has been terrific. Thank you so much for your time. We really appreciate it. And I hope it's been helpful to our viewers to think about what happens when the time comes. We have new things to think about now. Thank you very much, Susan.
Thank you, Nancy. It's a pleasure.